In an increasingly complex and interconnected world, individuals often find themselves facing ethical dilemmas that can have profound effects on their mental well-being. Ethical dilemmas arise when individuals are confronted with situations where they must make difficult choices between conflicting moral principles or values. These dilemmas can range from personal decisions involving honesty and integrity to broader societal issues like ethical dilemmas in healthcare, business, and politics. This review narration explores the multifaceted impact of ethical dilemmas on mental health, shedding light on the psychological, emotional, and societal consequences that individuals may face when navigating the treacherous terrain of moral quandaries.
Before we dive in, if you find this content valuable, please hit that like button, subscribe to our channel, and leave a comment below. It truly helps us grow. Now, let's get started.
The psychological toll. Ethical dilemmas often weigh heavily on the minds of those who encounter them. The psychological toll of facing such dilemmas can be immense, leading to increased stress, anxiety, and even depression. When individuals are forced to make choices that conflict with their deeply held moral beliefs, it can lead to cognitive dissonance, a state of mental discomfort that arises from holding contradictory values. This dissonance can cause emotional distress and, if left unresolved, may manifest as symptoms of mental illness. The anxiety of decision-making. One of the most immediate impacts of ethical dilemmas is the anxiety they provoke during the decision-making process. Individuals may grapple with feelings of uncertainty and fear about making the wrong choice. This anxiety can be particularly acute in situations where the consequences of the decision are significant, such as when a medical professional must decide whether to disclose a medical error to a patient. The fear of potential harm to oneself or others can lead to heightened stress levels and prolonged decision-making processes, taking a toll on mental health. The weight of ethical decision-making can be overwhelming. When facing these dilemmas, individuals often experience a whirlwind of emotions, including doubt, guilt, and apprehension. The fear of making a decision that may have detrimental consequences can lead to sleepless nights and a constant mental replay of the available options. In the case of healthcare professionals, the fear of harming a patient or facing legal repercussions can be paralyzing, making it difficult to make a clear and timely choice. This persistent anxiety not only affects the individual's mental health but can also impact their ability to function effectively in their roles, exacerbating the complexity of ethical dilemmas and their consequences. Moral injury. For some individuals, ethical dilemmas can lead to what psychologists refer to as moral injury. Moral injury occurs when a person's actions or inactions violate their deeply held moral and ethical principles, resulting in profound guilt, shame, and a sense of moral disintegration. Veterans who have been forced to make ethically challenging decisions in combat often experience moral injury, but it can also affect individuals in civilian life. This emotional turmoil can lead to lasting mental health issues, including post-traumatic stress disorder, PTSD, and depression. Relationship strain. Ethical dilemmas can strain interpersonal relationships, adding another layer of complexity to their impact on mental health. When individuals make decisions that conflict with the values of their friends, family, or colleagues, it can lead to conflicts and estrangement. The burden of carrying the knowledge of one's ethical choices, especially when they have harmed others, can create a sense of isolation and loneliness, further exacerbating mental health issues. The rifts that ethical dilemmas can create within personal relationships are often emotionally distressing. In the aftermath of such decisions, individuals may grapple with feelings of guilt and remorse, making it challenging to engage openly and honestly with their loved ones. The strain can manifest as strained conversations, arguments, or even complete breakdowns in communication. In professional settings, ethical conflicts with colleagues or superiors can lead to workplace tension and decreased job satisfaction. Trust, a crucial component of effective teamwork, can be eroded, making it difficult for individuals to collaborate and contribute effectively. In essence, ethical dilemmas not only impact the individual's mental health but can also fracture the social support systems that are essential for well-being. Overcoming these strains often requires open and empathetic communication, forgiveness, and, in some cases, professional intervention to rebuild trust and restore damaged relationships. The role of coping mechanisms. Coping mechanisms play a crucial role in how individuals navigate ethical dilemmas and their subsequent impact on mental health. Some individuals may resort to maladaptive coping strategies, such as substance abuse or avoidance, in an attempt to numb the emotional pain and guilt associated with difficult ethical choices. Others may seek healthier coping mechanisms, such as therapy, support groups, or meditation, to process their feelings and develop resilience in the face of moral challenges. The impact on healthcare professionals. Healthcare professionals often find themselves grappling with ethical dilemmas that can have a profound impact on their mental health. The need to balance patient autonomy, beneficence, and justice can be emotionally taxing. For example, when a doctor must decide whether to withhold or withdraw life-sustaining treatment from a terminally ill patient, they may experience moral distress, a form of psychological anguish resulting from being unable to act in accordance with their ethical principles. Furthermore, the consequences of these decisions can be far-reaching. Healthcare professionals who feel ethically compromised may experience burnout, compassion fatigue, and decreased job satisfaction. Over time, this can erode their mental well-being, potentially leading to the erosion of trust in the healthcare system and reduced quality of care for patients. The ethical dilemma of business. In the world of business, ethical dilemmas are a constant presence. Decisions related to corporate responsibility, environmental sustainability, and fair labor practices are just a few examples. When business leaders are faced with ethical dilemmas, the choices they make can have a significant impact not only on their own mental health but also on the reputation and trustworthiness of their organizations. For instance, a CEO faced with the dilemma of whether to prioritize short-term profits over long-term sustainability may experience inner turmoil. The pressure to meet financial targets can lead to unethical decisions that harm the environment or exploit workers, resulting in moral distress and potential legal consequences. This internal conflict can take a toll on the CEO's mental well-being and, in turn, affect the mental health of employees who may be complicit in these decisions. The societal consequences. The impact of ethical dilemmas extends beyond the individual and can have far-reaching societal consequences. When ethical breaches occur on a systemic level, they erode public trust in institutions and can lead to social unrest. In recent years, ethical dilemmas in politics, such as issues related to election integrity and government transparency, have had a profound impact on mental health at the societal level. The proliferation of misinformation and the erosion of ethical norms in the political sphere have created an environment of uncertainty and mistrust. This can lead to heightened levels of anxiety and stress among the general population as they grapple with the implications of these dilemmas for their own lives and the future of their communities. Conclusion. The impact of ethical dilemmas on mental health is a complex and multifaceted issue that touches individuals, professionals, and society at large. From the psychological toll of anxiety and moral injury to the strain on relationships and the erosion of trust in institutions, ethical dilemmas have far-reaching consequences. To mitigate the negative effects of ethical dilemmas on mental health, it is crucial for individuals and organizations to prioritize ethical decision-making, provide support and resources for those facing moral distress, and promote open dialogue about ethical issues. By acknowledging the profound impact of ethical dilemmas on mental health, we can work towards a more ethically conscious and mentally healthy society.